Hello all and welcome today. My name is Alexa Milne with CFIB and we're very happy to be here to present our COVID-19 testing, vaccines, and your employees webinar with our special guest today from Sherrard Kuzz LLP. If you are new to the GoToWebinar platform, I have a few technical notes to make before we begin. You'll see the webinar panel. This is the blue or orange flower icon on your screen. Here you'll find a handouts pane where you can find today's presentation to save and follow along if you like. There's also a questions pane where you can enter your questions for our panelists today. We try to answer as many questions either through the chat box direct to you or during the live Q&A session at the end of the session. Following the webinar, you do receive a recording of this session, and that comes tomorrow by email for you. And with that, I will now introduce Corinne Pullman, our Senior Vice President, National Affairs and Partnerships. Thank you, Corinne.
Thank you, Alexa, and good day, everybody. Good morning in some parts of the country, good afternoon in others. No, it's not Laura Jones today. Unfortunately, Laura was not able to join us for today's webinar, so hopefully I can live up to her very high level of quality and caliber and provide you with a bit of an intro here that is of use to most of you out there. So we are doing our 43rd weekly webinar, and we're very fortunate to have some special guests with us today. So in addition to myself, Corinne Pullman, I'm the Senior Vice President of National Affairs and Partnerships. I am joined by my colleagues Brendan Rolfe and Rachel Eng, who both, as part of their jobs, spend a lot of time talking to our members one-on-one, trying to help them up. Hi, Brendan, and hello, Rachel. So the three of us are going to be hosting you today, along with some special guests we're going to be getting to in a few minutes. So we have two lawyers, one Michael Sherrard, the other Mark Benoit from two different law firms, but they are going to be here to chat a little bit, and we'll talk about that in a few moments, what that's going to be all about. So we're fortunate to have them with us. But before we do that, moving on to the next slide, I am going to channel. We're going to make our commitment first, of course, as we always do, that information is always being updated on our website on a regular basis. And there was actually some news just yesterday that we'll be sharing with you today that we have put up on our website already to sort of talk about what the wage subsidy and the rent subsidy are going to look like going forward. But always, if you don't find that information or if you have other questions, always please give us a call. Our helpline number is right there. As we move to the next slide, again, I'm going to channel Laura here a little bit and throw a few quotes out just to sort of keep us inspired and keep us going through what continues to be a pretty challenging time. I thought the first one was quite good. You know, a knockdown does not always have to be a knockout, and certainly something I think we've all been feeling in the last little while, whether it's professionally or personally. But I thought the next one was somewhat poetic in its own way. You know, we can complain because rose bushes have thorns, or we can rejoice because thorns have roses. And I think that's a nice thing to think about, how you switch the way you look at things at times to sort of change your perspective from a more negative to a more positive way. And of course, the last one, impossible is just an opinion. Don't buy it, is one that I think it's a good reminder that it's really all in how we think. So if we move to the next slide, what we're going to cover today, there are a few new things that we thought were important. So I will hopefully answer some questions many of you may have about some of the programs that are out there, but we're going to spend most of our time with our guests, Michael Sherrard and Mark Benoit, on questions you may have. And these are questions we're getting quite often on our phone lines. Just a reminder that the subject matters and the guests that we bring in are always based on the feedback we get from you as our members through the webinars, through our helplines, and we're really here to just provide you with information. We know that there are a lot of questions right now around testing, COVID testing, how to deal with people in quarantine, around vaccines, what's going to happen when it comes to the employer's obligations and responsibilities and so forth. And so we don't really have a specific agenda here. We're really just trying to have people who can come in and who know this stuff and have thought about it more than we have, answer your questions around some of those issues. So hopefully that will provide some context. I know we had some members a little worried about where this was going to go, and that's really just the direction we're hoping to take this. All right, so we'll move straight into what's new. And certainly this week, just yesterday, the government did announce how the rent subsidy and the wage subsidy will work after March 14th, something we've been waiting for and pushing for several weeks now. In fact, just on Monday, we had put out a press release to ask government and push government to get this information out quickly, because we were less than 2 weeks away from the end of the period. And so by yesterday, Wednesday, 2 days later, we were pleased to see that they came out and announced that the wage subsidy will remain at the levels it's at right now, which means that the maximum wage subsidy you can get right now is going to continue to be at 75% right up until June 5th, which is 3 more periods. The maximum rent subsidy will remain at 65%. But in addition to that, the rent subsidy will still have a lockdown support, which will remain at 25%, which means that when that's put on top of the rent subsidy, you could potentially get as much as a 90% rent subsidy. So that will continue straight through to June 5th. The other thing they were able to clarify, and I know was a big issue for many, is what the reference periods will be to calculate your revenue loss. So if when it comes to that next period, that March 14th into April, you can now compare your revenue losses from March 2021 to March 2019. Now, if you're going to use the deeming rule and you want to be able to compare February instead of March, because maybe your February was not as good as your March, you would still have to compare February 2021 with February 2020, not 2019. So there's a slight complication for this next period coming up. So for that reference period, you either compare, you have to compare either February 2021 with February 2020, or you have the choice of comparing March 2021 with March of 2019. So we're trying to keep it all pre-pandemic, but it's going to be a little confusing for that first period of time. The other piece I just wanted to make sure people are aware of that they did announce is for anybody who still has furlough employees, they had made some changes to how the structure, not the structure, but how much they will get paid through the wage subsidy back in about the fall of last year. They're maintaining that. So they're trying to make sure that anybody on furlough isn't going to make more money than anybody who's on the employment insurance right now. So there's a maximum allowed amount that you can benefit of the subsidy that you can get for furloughed employees at $595 per week. So that is something, again, that continues from the way it was before. So that's the big news for the week. So hopefully that helps clarify things and allows many of you to plan for the coming 3 months up until June 5th. Of course, as an organization, we're going to continue to push for improvements to the rent subsidy program as we've been doing. And we are going to continue to push for the government to look at what's going to happen beyond June 5th. We know that's the next step because we also know many businesses are still going to be struggling likely by June. Even if things are going to be a bit more open, it's going to take a while to get back. So we want to make sure there's support still there for those that really still need it. All right, moving to the next slide. The one other couple things we wanted to mention is that, so there are a group of you out there, unfortunately, that have applied for your CEBA, this Canada Emergency Business Account Extension Loan, and have received a not successful response, meaning you have not yet been able to get that extra $20,000 loan that has a $10,000 that's forgivable portion, and you're waiting to find out more about next steps. You've been told to hold on. You were supposed to find out more by the end of February. Of course, we're now into early March. Earlier this week, EDC that runs the program announced that they will not be able to yet process those folks, so that there's going to be a further delay before the next steps are going to be made available. And this is due to a technical issue. They're trying to build a system that will allow them to actually have those business owners in that not successful category be able to resubmit certain documents, and that system is not, they've been having a problem getting it set up. They won't say exactly how much longer it's going to take, but they did say that people in that category will have until May 7th to be able to provide all of the documents that they need. Anybody who's not in that category that has not yet applied for a CEBA loan or the CEBA extension loan, you only have until March 31st still to apply. That deadline has not changed. You still have to get the application in by March 31st if you've not yet applied for a CEBA loan or a CEBA extension loan in order to get it. Quickly then, last couple things. Restrictions are continuing to ease, albeit slowly, in various jurisdictions across Canada, but we are still seeing lockdowns in a few places in Ontario and Newfoundland and Labrador. The other side of it, however, both Manitoba and Saskatchewan did announce extensions to their small business support programs. So if you're a business in either of those two provinces, there are going to be some more supports available to you in those provinces. There is a bit more detail on both of those in the appendix of this particular presentation. So if you want to find out more, please take a look at the handout that is just attached to this webinar, and you'll find that information in the appendix. All right, I think it's time to now introduce our guests. So I'd like to introduce Michael Sherrard of Sherrard Kuzz and Marc Benoit as well from L'Oranger Marcoux, and they're going to provide us with an overview on COVID-19 vaccination and testing, and then me and my colleagues will come back up and work with them on questions. Over to you, Michael and Marc.
Great, thanks very much, Corinne. I think we'll jump right in, so we'll move to the next slide if we could, please. What Marc and I are going to do is try to talk coast to coast as much as we can. We're going to start and talk a little bit about COVID testing and some of the things that are going on across the country, as some more of you hopefully are coming back into opening your businesses and getting up and running. Talk a little bit about contact tracing. A couple of comments with respect to rapid antigen tests that are now being piloted in a number of spots across the country. And then we'll spend the majority of our time probably talking about vaccines and what people should be thinking about as they run their businesses, and individual employers making decisions about what to say and not to say to employees about vaccines. And we'll try to answer questions when we're done. So as you can see from this slide, it's self-explanatory, and many of you are already used to this, but for those of you who are still working on coming back into the workplace, you're going to want to have a policy in place that covers off this slide and its content, so that your employees have consistent expectations in terms of what you think they ought to be doing. Many of us now have put in place workplace safety plans, and inside those workplace safety plans are communications to employees about our expectations around COVID testing. So first and foremost, you want to have in your plan all those symptoms that public health has been giving us across the country with respect to what illustrates a symptom of COVID-19. And you want all your employees to be aware about what they should be doing in the event of having any of those symptoms. The easy one is you don't want them coming into work. You want them communicating with you on the phone and then working through the protocols. And you also see in these bullets the kinds of things that will require them to speak up that aren't simply when they're exhibiting symptoms. And so that's when they've been advised that they've been in close contact with somebody with a confirmed case. Public health in one of your areas where your workplaces are has directed a test, and/or there are some workplaces now that are actually directing and requiring a test. And we see that in some of the rapid test antigen pilots going on. Marc, do you want to comment, or should we keep on rolling?
Just with respect to the second bullet, when we discuss close contact, particularly in Quebec, we're meaning contact with an individual for more than 15 minutes, less than 2 meters, and without masks. That's a definition in Quebec. There may be different definitions elsewhere as to what close contact is, but just to give you an example of what happens here.
And I think that's a great point, because that's evolving too. If you think of that federal app that they put out and had in place, the algorithms and the diagnostics in behind line up with what Marc said in terms of that 2 meters distance, and/or that you're inside the 2 meters and you've been in contact for those 15 minutes. I think public health continues to assess whether that's the appropriate test, and it's still evolving. So with that, if we could go to the next slide, please. And there are going to be situations where an employee says to you they're not going to go get a test, they refuse to do so. And unfortunately, we've had some situations where people with symptoms have failed to disclose those symptoms as well. And that's why we illustrate or ask you to consider, have a policy in place that actually speaks to what should happen in the event of that. And the policy is all about trying to educate and clearly communicate your expectations to your employees. Really, really critical, because there now have been at least a handful of cases across the country where an arbitrator has upheld an employer's decision to terminate somebody for either failure to have taken a test or failure to have disclosed symptoms, and therefore put other people at risk. And in each occasion, the arbitrator has relied upon the existence of a clearly communicated policy and expectation around this matter. If we can move to the next one, we'll just touch on this briefly. Testing costs. All of you know across the country right now that for the most part, the COVID test is being provided free of charge. But remember, you're looking at symptomatic close contact, back to Mark's earlier comment. And so we do have a number of employers across the country that are now sometimes in some unique situations deciding that they're actually going to engage a facility that will provide a private test, and that there's clearly a fee involved in that. And for the most part, the examples we've seen across the country, the employer has borne the cost and provided, frankly, the employee with time away from the workplace if they were going to require the COVID testing. Again, remember, we're not talking about vaccines yet. This is just simply about the COVID testing.
Yeah, just Mike, on that point, it can be quite expensive on a private. For a private test, it can go anywhere up to $250, depending on what the turnaround time is. Just so you know.
Okay, and if we could go to the next slide, please. Now, obtaining test results, one would think this is easier than it is, but it can be a bit tricky. So first and foremost, an employer is entitled to ask for a test result in any direction that public health has provided your employee with. And this is one, Mark and I have talked about this a number of times. For a negative result, a copy of the screenshot is generally sufficient. And what we mean by that is that negative result is communicated to your employees sometimes just through the app that they're carrying. And so often people find that challenging, but Mark and I think, have both given advice that simply getting a screenshot copy will be sufficient. Mark, do you want to jump in?
Well, there's no rule. The government sometimes provides written documents, but really it's by email, mostly for negative test results. So it's a bit of a scattered the way they respond. I've seen written documents, and I've seen mostly emails and screenshots. So there's no, it's not as consistent as it could be. That's the takeaway there.
Okay, and really one of the things we want, not just the result, we really want to know what period of time is that employee supposed to isolate, and that is evolving a little bit as well. But public health usually will communicate to the employee their advice as to how long they should isolate. And I think it's been confusing for some because it goes back to when they first experienced symptoms as opposed to the date of the test or the result. And therefore, there's some variation in terms of how long somebody may be staying out of the workplace when they first speak to you, because the symptom may be in the rearview mirror, a number of days beforehand. So with that, let's move on again to refusals to provide test results. So again, we start, and everything you're seeing is we're trying to assist employers in terms of much better in these areas to be attempting to educate, persuade, and influence, as opposed to simply have a disciplinary response. So the slide, for example, is built on purpose like this. We want to first explain why the result is important for the employer to be aware of, and that really goes to contact tracing and the ability for an employer to assist in limiting the potential spread of this pandemic. And I think there's some different looks here. So I'm going to pause there because I think in Quebec, Mark will talk or tell you about public health's role versus the employer's role. And Ontario, as an example, is somewhat unique, I think, in their approach to this, different than in Quebec. But Mark, jump in.
Yeah, I mean, we have, government has identified numerous places, and you can go to the website and the addresses are there depending where you live. And really it's up to public health to do these tests. And also it's public health will be doing any tracing. So there's no responsibility on the employer to take active measures to contact trace. In other words, the information will be communicated to public health, and public health will be the ones communicating with anyone who's been in close contact with someone who's been who has the virus. So it's really in the hands of public health at this point. And basically what has to be done is, if you have to test an employee, then you have to direct that employee to a particular location. And from that moment on, public health will inquire who has been in close contact, and they will be the ones doing the contract tracing in Quebec. I haven't seen operations where the employer has been responsible to contact trace. I don't know if it's the same, Mike, in Ontario, or what other responsibilities the employer has. But really, our main focus is to send the person to the right public health outfit. And from then on, it's taken by public health, and they have that in their hands, and they'll do the additional steps where and if required.
So I'm wondering if you don't mind me jumping in, Michael and Mark, because I got a question here that I think is directly relevant to this particular area. So Marcy is asking that she said that she's reached out to Employment Standards in Alberta and asked the question if they can insist on employees giving them the test results, and they were told no, because that's a privacy and human rights issue. So can you maybe give some more context there for Marcy about what she may be experiencing?
Sure. I think as you go across the country, and depending upon which regulator you communicate with, we may not be getting consistent requests. And a lot of it, we think the best advice is to default back to what Mark just talked about. Look to your public health guide. And your public health is really saying, in the event of a positive COVID test, right? And if I can't get that information, that's a problem from the perspective of being able to comply with all my other health and safety obligations. Because at the end of the day, each employer across this country still has that basic health and safety obligation that says take every precaution reasonable in the circumstances. And one of those circumstances arises if we get either a COVID positive or somebody with symptoms. And so I'm perplexed, I'll say, Corinne, to be polite for a moment, with respect to the Alberta Employment Standards answer, because it's that positive test and the information that allows me to now go back and contact trace. And maybe I'll pause there for a moment.
Yeah, because I think that's where businesses get confused, because they have different agencies giving them different direction, right? And so when can you make the decision about which one supersedes the other? Is it employment standards? You know, is health and safety supersede employment standards? And I think that's what a lot of small businesses are finding themselves struggling with right now, is that they have a direction for one and a different direction from the other. So what advice would you give to them in those situations?
And I don't mean this to be too self-serving, because the first thing I'd say is contact local counsel. And instead of local counsel, they might even start with your business counselors as well. Because I've gotten great feedback in terms of your business counselors, but I've also had people come to us with, especially I'll give you a Toronto example. What Toronto Public Health says has been different than London Public Health, which has been different than Peel Public Health. And so, unfortunately for a lot of employers, I'm not sure we're going to be able to solve that consistency element that we think employers deserve, frankly. So we start with build the policy, right? So get some help, put your policy in place, communicate it to your people. And I'd always, if I got to an employment standards officer who gave me what I believe to be incorrect information, I move up the chain. I'm careful with how I do it, but I move up the chain, especially if you're potentially even getting an order, as an example. So it's, you know, it's unfortunate, but I think we're all living through it, and I don't think that's going to get cured anytime soon. We see a variety of directions across the country.
Yeah, and I think that's part of the sort of evolution of what's happening right now, is it's a bit of a mishmash, and where everybody's trying to do the best that they can. So thank you for that. I think the advice to potentially call a business counselor, call your local lawyer counsel as well if you're in that situation and you're not clear, because unfortunately even the government regulators aren't necessarily as clear as they could be. So
yeah, I think that's bang on. And look, oh, sorry.
I was just going to say, I'll let you continue with your presentation. Thanks.
Thank you. We go back to Mark's comment as well with respect to public health dealing with all the contact tracing. I think if you're an employer in Ontario, as an example, you're actually having become used to having to do some of your own contact tracing and being a participant with public health. And so I want to just touch on that area, because we have requirements now for many of our employers where you're going to have a health screening questionnaire, which everybody is used to, but also a log with respect to who's worked on what day, on what shift, and where. And so keeping that log is actually a requirement now in a number of workplaces across the country. And that log is something that public health can ask for and use to assist it with the contact tracing. Because the basic is public health asking the employee who they worked with, who they were in contact with, similar to Mark's comment, right? who have they been in contact with in that infectious period of time inside the 2 meters and for more than 15 minutes. And that, for a lot of us, that will include our families, but it may include carpooling. There's a variety of things. It may include the shift I work on. In public health will do some of that work, but in Ontario, they're actually requiring Ontario employers to participate in that process. And then finally, a couple of things when you're talking to employees. I think employees are quite worried about their personal health information. And so it behooves employers to illustrate to the employees why you're asking, what you're going to do with the information, who has access to that information, where is it going to be stored, how long will it be stored for, and when and how will it be destroyed. A lot of what I've just said are basic privacy principles, but it behooves you to think about those as you get into these refusals, because we've had them already, but we're going to have more of them as we go forward. We can move to the next one, please. So, and this should be set out in either your work safety policy plan that many of us have in place and or a COVID testing plan, but it's pretty straightforward. The variation really is about how long somebody's going to have to self-isolate, and you can see examples of where the timelines are. And you can get some help from public health, obviously, on this, at least in Ontario. Mark?
Yeah, well, in Quebec, it's the same thing, and it's very well prepared on the government website. All that information is there, and it's quite easy to access, to navigate that website, and all the information on every topic is there, and it's quite easy to find your way.
And I think we've covered the next slide, slide 15, so I think we should go to slide 16, if you don't mind, please. And so this is somewhat unique to Ontario, but we wanted to make sure you are aware of it. So typically, just mechanically, you have an employee who's gone to public health and has been made aware that they have a positive COVID test. That employee has called you to tell you that, and now there are some obligations that are statute-based in Ontario. The first one you'll see is public health, depending upon which region you're in, is advising that you must now contact the Ministry of Labor, Training, Skills and Development, and you must fill in a form pursuant to Section 52.2 of the Occupational Health and Safety Act. We raise this simply because here's the debate. Some employee may say to you, I've got a positive COVID test because my child tested positive, and I think I probably got infected through my child, as opposed to I'm on a shift at work and I believe I got infected by that other person who tested positive. The challenge in Ontario is public health is saying, and they're interacting effectively with the Ministry of Labor, Training, Skills and Development to say, if in some situations, so you got to check your region, if there are more than two or more people testing positive in a defined time frame in your workplace, you now must fill in that form. Now remember, the premise is you're reporting about an occupational illness. Now many employers will say, no, wait a minute. My employee has told me that they attracted this at home. So this isn't a workplace related event. Unfortunately, the position that's being taken by these officials recently has been, doesn't matter, two or more in a workplace, depending upon your region. So again, for the listeners, please figure out which region and what public health and the ministry is asking of you. And you can get that information proactively. But if they're asking you to do it, you fill out that form. Our advice is, if you feel that the person who is COVID positive, therefore requiring you to fill out the form, didn't attract the COVID positive in the workplace, you say that in the form. I'm reporting because I'm told I'm obliged to report this, but it's my position that the two employees who tested positive actually have communicated to me that they feel they contracted this through their family at home, as an example, if that's relevant. Again, we want to be correct in our information, but just watch in Ontario for that cooperation between public health and an employer's obligation to report.
Yeah, just on that point, Mike, in Quebec, there's no such obligation. There's no specific requirement to declare whether two or more. But again, the occupational illness can be an issue, but it will depend on whether it was employment related or not. So it can be a claim, but it has to be in association with the workplace.
So maybe let's jump into the tougher subject. What are we going to do about vaccines? And maybe let me tee up a question for Mark to start us off with. Let's go to slide 18. Mark, what's your view in Quebec? Can an employer implement a mandatory vaccination policy? What's going on in Quebec on this?
Well, the short answer is no, you can't. There's no possibility of mandatory vaccination. When I say mandatory, I'm saying an employer cannot ask or order his employees to go through a vaccination. Only the government can impose that under the Public Health Act, Section 123. But there are all sorts of hurdles that an employer will find if he wants to implement a mandatory vaccination policy. The civil code is clear that it's a violation of the person, the Charter of Rights and Freedoms, and case law is abundant. There'll be maybe one exception if it's a bona fide occupational requirement. I'm talking about medical facilities where the employee will be in touch with a vulnerable population. But apart from these very limited exceptions, the rule and the answer to that question is that an employer cannot put into place a mandatory vaccination policy. And the other issue is very practical. I mean, you can wish all you want, but the vaccines presently are not widely available. They're going through steps by category, and I'm the 10th category, the last ones will get them, and it won't be before September. So there's a practical issue here that even if you were to put into place this mandatory vaccination policy, you probably won't be able to implement it for practical reasons. So that's in a nutshell what's in Quebec.
So Mark, would you be a fan though of putting in some kind of general policy, not making it mandatory, but sort of listing out expectations and the options?
Yeah, I think what you want to do is sell, do a sales job with respect to why vaccination is the good thing, the good route to go. And I think that would be the positive spin I'd like to put to a policy, not a mandatory vaccination, but a very strong suggestion that they should. And just to give you a number, Mike, in a recent poll in January this year, 74% of the population say they will get vaccinated. So we're almost at the threshold of the immunity required, which is 70 to 80%. So it's a very nice theoretical question, but when you find out that almost 80% of the population is going to get the vaccine, the mandatory issue sorts of fades away, because that will not be required if you've got that 80% of people going through it anyway. So, a very positive suggesting why they should, and that's the way I'd spin the policy on vaccination. The science.
Sorry, maybe let's touch on some of those things that if you are going to put a policy in place, and remember, you can put a policy in place not because you're trying to make it mandatory. And this should be for every employer, this will be your individual choice, but we still commend you to put a policy together. And at the end of the day, that policy will allow you to communicate consistent expectations to your employees in respect of these vaccinations and all the outcomes. So first and foremost, go back to Mark's point. Are you dealing with a population that is severely vulnerable to this pandemic? So for example, if you're running a long-term care facility or a retirement home facility, that fits into Mark's narrow slice where it may be mandatory, but again, you want to consult counsel and work through that. If you put a policy in place, think about limiting the application. Who does the policy apply to or not apply to? Do you have a group of employees who are constantly in contact with the public, as an example, as a requirement of their job, and they're not able to physically distance? Now, many of you should be thinking out loud, well, no, wait a minute. The way my place is set up, I've already got all the PPE in place. I've got barriers in place. And so all of those kind of PPE requirements may mitigate or undercut the need for any kind of required vaccination. And by the way, as I say that, I still agree with Mark. I think the way the law is structured it'll be an uphill battle for most to try any kind of mandatory vaccination. I think the only place you're going to get there is in those vulnerable populations where your employees are directly in contact all the time. So if you put a policy in place, you also want to make sure that policy is seen to be non-disciplinary, because sometimes an employee will simply say, well, I know you'd like us, to Mark's point, I'd like you to go get a vaccine, but I don't want to. Is it a personal choice issue? Or could it be one of the human rights code bases that we want to, as employers, be aware of? Can somebody have a disability of some sort that warrants not getting the vaccination? We know there's a fair bit of mixed advice out there right now from a family perspective. If somebody is pregnant, and there's a code-based prohibition on discriminating on the basis of sex, and that's where that would fall under. And then there's also a religious prohibition as well. Somebody may have a religious belief that warrants them not getting a vaccine. So again, these are just some of the things to think about. But as we leave this slide, I want to key in on educate, persuasion, and influence. That's really what employers want to be doing right now. I'm going to be more optimistic than Mark. I'm probably the same age as Mark, but I listened to the radio this morning and they said we're going to get vaccines by June. I'm not putting any money on it. I'm probably in with that lineup with Mark in September, but I actually think the vaccines may speed up, and if they do speed up, then employers are going to have to speed up too with respect to their positions on this. And again, the position should be outlined in a policy if you want to do this correctly. Remember, if we go to the next slide, we'll cover Mark's point off really quickly. Availability, there's your first question mark. Current understanding and science of the vaccine, that's causing a lot of angst, and I hope we get societal take up like Mark's poll that he talked about, but there's a ton of angst. BFOR is exactly what Mark was talking about earlier, called bona fide occupational requirement. So is it a bona fide occupational requirement that you have a vaccine? And again, we think that's going to be in very narrow circumstances. Let's move to the next one. And so here again, this really says you got to get that policy in place, because if you're going to collect information, not only requiring somebody to get a vaccine, but I've seen some questionnaires now that actually ask the question, have you been vaccinated? If you're going to ask that question of your employees, and I've actually seen some people ask it of customers, in either of those situations, you also want to be able to ensure you are on side with respect to provincial privacy legislation, if applicable in your workplace. So we're not really going to comment much today about unionized workplaces, but do be aware and cautious with respect to what you're doing with that information if you're actually going to collect it. And it's really critical because there is some liability that can arise from that if you don't. We go to the next slide, please. This is what we think you really should think about. Come up with an incentive. You're trying to educate your employees with respect to the benefits of that vaccine, because remember, the government has said highly recommended, but it doesn't say mandatory. Now, maybe that evolves over time and as science changes, potentially, but right now they're not even recommending it as, or not using the words mandatory. And so a lot of us are looking at, is there a way to incentivize my employees to get this? Because maybe it becomes something that I want to brand. You're coming to a store where all of us have been vaccinated. Again, individual employer choice policy, but remember, probably not able to enforce it as something as is mandatory. So let's just maybe talk. Let's talk takeaways and then move on to questions. So takeaways are on that next slide. So again, we really want to emphasize as we leave this topic, you're trying to encourage voluntary compliance. If you're going to collect data, remember, think about the privacy piece and how, what am I collecting it for? Who has access to it? How is it being secured? How long will it be kept for? How will it be destroyed? You want to have this clearly set out in a policy. You want to spend time in advance educating employees as to why you're doing this, why you want them to do this. And again, want as opposed to order, want as opposed to order. And then enforce any policy you put in place, really critical. that you enforce it consistently. And let me leave you with the following. Let's assume I put a general vaccine policy in place, not mandatory. Remember, the liability arises two ways. Let's assume I say to an, and this isn't the advice we're giving, let's assume though an employer says to an employee, I require you to go get the vaccine, and the employee says no. What's the next step, Mark, if an employee says no from that? Can an employer do anything about it? What would you suggest?
Well, certainly in Quebec, it would be problematic because really you can't force someone to a medical procedure, and vaccination is a medical procedure. And Section 11 of Civil Code is very clear that you can't do it. So you don't have very much options. The answer is no, and it's the employee's choice. So it's a very difficult situation. I don't think you can act on that negative answer in any meaningful way. You can't discipline the person because it's his choice. So it's sort of no issue there. There's no way to get out of that problematic. So even asking the question is begging for a no, and you'll not be able to get anywhere after that. Unless you're really in a specified field, as the exception, the bona fide occupational qualification. If you're not there, you're not going to be able to do anything in case of a negative employee answer. Simple as that.
Let me ask you a controversial one as we wrap up. Is it okay for me to say to my employees, if you go get a vaccine, I'll pay you an extra $100. I'll pay you for the time off to go get the vaccine. I'll even pay you to put you in a cab to get there. Are any of those offside, or are they okay?
I think we're on the safe side with that. But I don't see any legal principles which would not allow an employer, for instance, to give paid time off to go get vaccinated, to pay the taxi cab, other benefits like that. I don't see a problem. I don't see any contravention in any meaningful laws. It's not a human rights issue. It's not. I don't think it's anything criminal. I don't know what you think, Mike, in your neck of the woods, how it would be perceived.
I agree 100% with you. I think it's something that you can do. You want to think about it. I mean, I've seen people trying to come up with a variety of means to incentivize people to get that vaccine so we can get to what the science is. As I listen to the news, they keep talking about that herd immunity. And so a lot of us are thinking anything that contributes respectfully or lawfully to getting more people to take the vaccine, the better off we're all going to be. Corinne, I think with that, that's probably where Mark and I should wrap up with the formal part of this, and then hopefully we can be of some use in asking or answering questions from your listeners.
Absolutely, and thank you for that. That was hugely informative. And we do have a number of questions coming in, but where I want to start actually, and I'm going to have my colleagues join as well, but where I want to start actually is around a couple of questions that come in when you were talking about the encouragement of asking people to get vaccines. So encouraging them, but not forcing them. However, a couple of folks have talked about what about the liability if the employer incentivizes or encourages them or strongly encourages them to get a vaccine and they have a negative reaction to the vaccine. What happens then? Can the employer be liable because they may say, well, they made me do it? So what would happen in those circumstances?
So my quick comment is you've given me a great example as to why that policy is so important, right? That mixed communication. Did they require me to? Did they make me to steal your words for a moment? Versus they encourage me to. And your policy should make that awfully clear in black and white. And so I think you're still, as long as you got a policy in place, I think you're in good stead. But I also think I've heard the federal government talk about a potential coverage in this area. And I know it's not out yet, but I know I've heard a number of people talk about the potential for workers' comp-like coverage. And I raise that only to say stay tuned. But first and foremost, put a clear policy in place so you don't run into that, or at least you mitigate your liability, or you mitigate the miscommunication.
Yeah, and also the issue, Mike, I think would be to figure out whether this falls within occupational illness or work accident, because and the employer would be probably a no fault there if it's judged to be in relation with the work, then it would go under the government plan and there would be no liability attached. But again, I think to make sure we don't get into that issue, the policy, the way it's written, the way it's set up is going to be crucial.
Right. Okay, so others are saying, you mentioned in one of your scenarios that you may want to, tell your customers that everybody's been vaccinated, right? So one of the questions that came up as a result of that is, if you want to tell your customers that the full staff have been vaccinated, do you need to have consent from all individuals prior to sharing that bit of information?
I think that, I think whoever put the question in, it's great advice. And I mean it that way. When we think of anything that is considered to be personal information, let alone personal health information, how we use it, who we communicate it to, 100% you want to comply with your privacy policies. Remember, across the country, British Columbia, Alberta, and Quebec are the 3 provinces that have their own provincial privacy legislation. And for many of the rest of us, we have the federal PIPEDA, and/or we might have specific personal health information legislation. So it's a bit of a matrix, but your listener who put that question in, or I'll call it advice, because I think it's great advice, you want to seek consent, right? And you want to tell them why, right? And the first principle in privacy is informed consent for a limited purpose.
Okay. I'm going to ask a couple more on vaccination, then I do have some on testing that I want to get back to, but you did touch on this as well, but just to sort of reiterate, Michelle was asking, can you include in your vaccination policy that although it is not mandatory, we need it to know who is vaccinated for record keeping purposes? This goes back, I guess, to that privacy, like you have to sort of say that, can you put that into your policy? And then, but then have maybe something that says, we'll keep your information private and only use it with your consent or something like that.
I guess what I would say there is, why are you collecting that information? There has to be a purpose to have that record, and I'm not sure there's any useful purpose knowing who's been vaccinated or not. It's not, for instance, for insurance purposes, for private insurance. I don't know what the purpose would be to have that, who has and who hasn't. That's my issue there. Like, I don't see why we would be collecting that.
Yeah, and just for clarity, because I'm not sure I said this before, the example I used where somebody's actually collecting that information, they're in the healthcare industry, very specific industry for it. And the other thing I'd say is, I think the advice these days is, even if you get a vaccine, that doesn't mean we're not distancing, we're not using PPE like masks and so forth and barriers. So I think I default back to agreeing with Mark, obviously.
Right. And I guess related to this is, if you offer to, you talked about incentivizing, and so somebody's asking, if you offer to pay for time off for them to get the vaccine, can you request proof of vaccination? Again, it goes back to your vaccination policy, I would imagine.
Yeah, and I think in that situation, I think you could do it, but it has to be clear in the policy. And the last part too is, please make sure you're consistent with the application of the policy, because you'll just cause yourself headache, I'll call it, otherwise.
Right. Okay. So Rachel, I saw you came in and out. So do you have some questions you'd like to ask?
Yeah. The questions are just coming in. I think the members are really loving your presentation. I have Laura who's asking if employees refuse vaccination, can employers require them to wear PPE while they're in the office?
I think for me, the short answer is yes.
And as you said, Mike, it's not because you're vaccinated that you abandon all the other measures. Those are kept in place anyway. So it's not because you're vaccinated automatically all the other measures come down. Because there won't be 100% vaccination rate anyway. So I think you mentioned that a few minutes ago, that it's not because you're getting vaccinated that you abandon the other measures, distancing, mask, and other safety measures.
Yeah, that makes a lot of sense. I also have Kathy who is asking about an employee who travels between gray zones and another zone to look after parents. So what would be some of their obligations that they should be considering in that scenario?
Yeah, I think the first thing I'd say, and we didn't really introduce this concept earlier, but if you think of sort of the standard of care or the duty of care, that tort-based piece, again, I default immediately to public health. Public health has got great guidance when you're crossing boundaries, and certainly if you're sitting in Toronto right now, they prefer us not to be traveling to Barrie, as an example, right? You think of the restrictions in Toronto, and I think still in Peel. So I think you default right back to what public health is saying, and sometimes I even put that in the policy. Sorry about that. Will be governed by what public health says, and you can put links into your policies, hot links, so that it's actually current and evolving as well.
Absolutely.
All right, Brendan, I see you popped up. Is there a burning question that you wanted to bring up?
Yeah, so it's a question that's having sort of different scenarios. People are asking about various clauses and saying, you know, if we require an employee or give preference to an employee because they're vaccinated regarding scheduling or regarding sick benefits, are we allowed to do that? And so just as a general statement from me, and definitely Michael and Mark, I'll let you guys, you're the pros, so I'll let you comment on it. But from a human resources standpoint, anytime we show preference to an employee, or we show disciplinary action or something that can be taken as a negative action toward an employee for any one of the protected grounds under the BC Human Rights Code, that leaves us exposed to a potential discrimination claim under the Human Rights Code as it stands across each of the provinces. So basically, we can't give preference to someone because they refuse to choose to be vaccinated, just like we can't discipline them for choosing not to be vaccinated or do something that would be considered a negative action towards them. Do I have a good handle on that, Mark and Michael, or is there some other things you'd like to add?
No, I think that's the right answer. I mean, I'm not sure whether we want to get into a discussion whether not getting a vaccine is covered by a protected ground of discrimination. You know, we can have a discussion all day on that, but as a general principle, I think you're absolutely right, Brendan.
Yeah, the sophisticated legal response for me, Brendan, is ditto. I agree with what you said.
Perfect. Appreciate that.
I was hoping to just touch on a couple on the testing side, because you had, you know, we don't want to forget that that's a whole other area that's probably even more relevant right now. I had Lisa ask about if an employee refuses to be tested and we ask them to remain off work for 14 days, is the employee required to pay, or does the employee use their vacation days?
Yeah, it starts first with what your policy says. So you might have paid sick day in your policy, but if you do not have paid sick day in your policy, you're not required to pay, right? So you watch for provincial legislation as well, but it's what's legislation say, what's your policy say. If they're both silent on paid sick leave, then you're not required to. But I would say I've seen a number of employers allow employees to opt into taking some of their accrued vacation pay.
Okay. All right. Ultimately, it comes back down to that very important policy. That's the fundamental piece of advice I think we're providing here. I just wanted to share a couple scenarios that not necessarily questions, but Wendy wanted to share that she had an employee test positive after 14 days, no symptoms, but continued to test positive. Fraser Health then wrote a letter saying that although he was testing positive, it was safe for him to return to work. And she just wanted to share that this is a possible outcome of what's happening. So also for other employers out there, that this is something that sort of adds to the complexity of the issue that we're dealing with, of course, is that, you know, even with some people still have positive outcomes, but they're still safe to go back to work given the length of time that they've been dealing with that particular COVID illness. But that is some of the challenges that we face, of course, in this rather challenging time. Rachel, you're back as well.
Yes, I kind of have a question come up that's kind of relating to what you just mentioned. If someone tested on the first day that they found out they were in close contact with someone who was positive and they agreed to quarantine for 14 days, can the employer ask for a second test at the end of those 14 days is Sandra's question.
I think the general advice across the country has been no to the second test. And I think that's what we're hearing out of public health as well.
Right.
Great. Hopefully that helps you, Sandra.
And I'm going to say, well, you might want to stick around, Rachel, but there is, again, Debbie, and this goes to something that other people have been bringing up as well, that she said that she has 3 employees from 3 different health unit regions and have had all 3 give their employees slightly different direction in terms of where isolation and testing are required. So as an employer, does she follow the advice of each employee is given from their health units, or does they follow the recommendations from the business's health unit? This is where it gets complicated.
Yeah, let me give you an example, just not to dodge the question, but just some examples by analogy for a moment. Across the country, every province has unique or subtly different vacation pay and time minimum standards. And so in those situations, what I see employers often do, they make the choice as to whether they're going to comply individually in a province, or they're going to comply with the most, the highest vacation requirement and put it across the country. So in my brain, I use that analogy for a moment to say, if I've got 3 different directions, isolate for the next 14 days, isolate for 10 days, isolate for 15 days. If I get 3 different directions, I probably look at the highest that's going to work for me. And I mean, remember, I'm still sympathetic to employers who say, but I need them back to work. Remember, at the end of the day, we need them back to work, not at the risk of infecting the rest of my population. So these days, I commend employers to think about, somebody says to me 20 days as opposed to 16, I probably go with the 20. And I think the other thing, Corinne, I'd say is I default to getting some medical advice in that situation as well. Like most of us will be able to reach out to public health directly or others to get a little bit of guidance, because your listeners' comment, I think, unfortunately, it's a frequent experience across the country where we're getting different guidance depending upon the regions.
Great, but it does show as I like to say, the messiness of the situation we find ourselves in, because everybody is still trying to figure it out. And so I think that idea of going to whatever the longest is, just to be on the safe side, is one that is probably a good idea. I'm going to ask if there are any more questions from my colleagues, Rachel and Brendan, that I know are working away in the background, trying to answer as many questions as they can one-on-one, because we're coming to close to the end of the hour. If none of them pops up, I'm assuming one of them is.
I have Richard who's asking, when you're putting together a contact tracing list for an employee who has tested positive, how does one rate the other employees as low or medium risk? And I thought I should try to put this towards you guys, Michael, to see what you would say.
I think I start with, am I in a circumstance where risk is defined as within 2 meters for more than 15 minutes? That's usually the standard a lot of us are looking at. So when we do that, a couple of things have come up most recently. It used to be, well, who's on the shift on that same operating line, as an example. But what has started to come up now is we're seeing some advice that pre-shift work, having everybody in the same lunchroom together, the smoke break area, also carpooling. And so those other 3 or 4 examples now start to come into that risk, I think, Rachel, with respect to things employers need to be aware of. And I've certainly seen the ministry start to trace backward into things as I'd say a little bit disconnected from the workplace in terms of carpooling.
Good to know.
Brendan, do you have any last questions you wanted to ask?
I had two, and I'll just give Michael and Mark a breather for half a second because I think I can respond to them, but they're great questions. I got a few questions, people saying, you know, why should I implement a vax policy that encourages people to vaccinate? And this can tie actually directly to your WCB premiums. So if you think about it, a lot of the WCB boards across the country now are accepting COVID claims as a workplace injury. And so obviously if you get your people vaccinated, there's less of a chance in theory, for them to contract that potentially at work as well. So it could impact your WCB claims. So that could be one of the reasons to incentivize that if you want to attach a financial incentive to it. And the other question too came earlier in the webinar, and I've had it again here, is regarding the hierarchy of the acts and, you know, which one you have to pay most attention to. And employee safety is paramount. They've said that across the country. And so what we see is kind of a 1A, 1B situation where it comes to Workers' Compensation Act versus the Human Rights Code. Is Workers' Compensation Act is right there, just an inch above the Human Rights Code, is that you have the responsibility to keep your workers safe above all else. And so what we want to do is we want to ensure that we do pay close attention to both the Workers' Compensation Act and Human Rights Code, and then employment standards just below that. But ensure that in your mind, if you have to make a snap decision, is think, is this safe for my worker? And make your decision based on that, because as the gentleman mentioned, being reasonable, what a reasonable person would do is always taken into consideration. And as long as you are acting with the best interest of safety for your employees in mind, it would be difficult to be found, you know, to be non-compliant or that you haven't practiced due diligence. So I just wanted to speak to that as well, and hopefully that answers some of the questions that came in. That's all for me, Corinne.
Corinne, I think that's a great point he's raised. I just add the Health and Safety Act, which is right beside workers' comp, frankly, from Brendan's point. Every precaution reasonable in the circumstances. You're going to get, some employer is going to run into a situation like Brendan suggested where, you know, no matter what you do, you're going to violate one of these. And if you're going to violate one of them, I really do, I do say stay on side on health and safety. I think his advice is great on this point.
Agreed.
Great, thank you. I just wanted to let our listeners know we're probably going to go over a few minutes just because there are so many questions. I wanted to sneak in one more too before we start shutting things down. And so I wanted to just sneak in one because it has more to do with clients than with the employees. So Dave is asking, he's a home builder and wants to know, does my client have the right to request the service technician have proof of vaccination before they entering their home? How do the privacy laws apply in this case? Can you give them any thoughts on that? Because that'll likely be another area that's going to be coming up as well.
Yeah, I think I default back to how Mark started this whole presentation on the inability to have mandatory vaccination. Start there first and foremost. Your challenge is a consumer, so the person who's hoping you'll come in the home to renovate or fix, may, I don't know whether I'd say unlawfully, but I think it's getting pretty close. If they're requiring that, I don't know that they're going to be able to stay on side of, for example, the prohibitions. I think I start with Human Rights Code. Like start with the Human Rights Code, then move to privacy. But even on the Human Rights Code, if you take our advice to begin with that we can't have mandatory vaccinations, it's going to be pretty hard for a consumer to make that a condition. I still think somebody's going to run into it. And I still think a consumer is going to make a choice not to engage you as a result. I still think that's unfortunately a risk. But Brendan, you look like you're about to jump in.
Apologies. No, I wasn't actually. I was just answering a question on my screen, and I wear my heart on my sleeve and my emotions on my face. So no, you're doing a good job answering. Sorry, Michael.
Okay, well, thank you, Michael. I think that's helpful. And again, obviously, as I keep saying, this is a situation that continues to evolve. I suspect the legal pieces around it will continue to evolve. Governments will continue to hopefully bring more clarity because I know there's lots of confusion still out there. I'm hoping that this helps answer some of the questions. I want to thank Michael and Mark for joining us here today. I want to give you an opportunity to say a final few words before we move it over to my colleagues, Rachel and Brendan. Is there anything else you'd like to add, Michael and Mark?
Go ahead, Mark.
Well, I think it's a very vast subject, and we could only talk about certain issues. Certainly, there are probably other questions, and certainly don't hesitate if you need our input for any particular questions you get from now on. We've tried to hit the high notes, but it's a vast project. But so we have only time to look at the highlights, and there may be questions to follow, but then we'll be available if that's necessary.
Corinne, I'll be very brief. I've got sort of 5 words. Be reasonable, right? Take your time and be reasonable. Exercise patience as an employer, and you're really going to need patience. And then my final 3 words are policy, policy, policy.
Yeah. Thank you, Michael and Mark. We really appreciate having you here today. I know, Rachel, I think you want to sort of mention a couple of quick things before saying your final words. So why don't you go first?
Yeah. So I did get a couple COVID program questions that I just thought I should throw in there. One was whether with the new announcement of the revenue drops and whatnot, if people could use, if they could change their calculation method from the general to the alternative. And from what I know, I'm not entirely sure yet. So that's something that we've sent to CRA, and we're still waiting for that response. Didn't know if you had heard anything else on your end, Corinne.
No, I have not. My assumption is you probably cannot change it, but unless you change all of them, but we'll clarify that over the course of the next week.
Yeah, and I also got something from Jean-Pierre who was wanted to bring up HASCAP and eligibility questions, and just wanted to remind everyone that next week we will actually have a webinar relating to the HASCAP with the BDC. So we'll try to keep that question for next week, if that's okay, Jean-Pierre. And then for me, there's actually one last question I wanted to address, and that's Smitha, who says, is it necessary to have a vaccination policy? And that kind of touches on what Michael was saying. So yeah, is it necessary to have a vaccination policy, Michael?
I think the short answer is yes. And I say this simply to reduce the amount of questions you're going to field. Like, communicate effectively with your employees. So some people, if you don't do it that way, they're going to wonder in the vacuum. They're going to wonder whether you're favoring somebody or not favoring somebody. It really does behoove you. It doesn't have to be a long policy, but it can at least communicate effectively what your expectations are and why.
That's great. That was going to be one of my tips for the end of today. But thank you to Michael and Mark as well. And yeah, we'll actually be working together to create some sort of vaccination policy draft for our members, which I'm very excited about. And you guys can definitely keep an eye out for that in the future.
Thanks, Rachel. Brendan, any final words?
Yeah, just want to express a huge thank you to Michael and Mark, and to all the listeners on what great value we got out of this one. This is I'm always excited for our webinars, but I can't even tell you guys what great information you just received. They'll keep you on the right side of the law, hopefully, and I'm very excited for that policy too. We had a lot of questions about that. Is CFIB has provided policies in the past, and are we going to this time? And I guess cat's out of the bag. Is that yeah, we're working on it right now, and there should be a lot of value there too for CFIB members. So just a huge thank you to you guys. Absolutely invaluable information, and it was a pleasure. It's all from me.
Thank you, Brendan. Thank you, Rachel. Thank you, Michael. Thank you, Mark. Thank you all for joining us here today. We really appreciate having you again. We know these are complicated times and these are complicated issues. We'll continue to find ways to bring clarity. If you still have questions that we were unable to get to today, please call our helpline. It is up on the screen right now. We're here to help you. We're here to support you. We're here to make sure that we can help you get through this very challenging and difficult time. So with that, we're going to close the webinar for today. Thank you, everybody.